Review client's previous medical records and doctor's orders sheet if available to see if there are any past medical history. Okay, so this is the first assessment of the client here at the hospital. Determine the scope of assessment needed. Prepare necessary equipment. The assessment we will be conducting today will involve the posterior and anterior thorax using the IPA, inspection, palpation, percussion, and auscultation. And these are the equipments that we will need to use later on. The stethoscope to hear and listen to the sound of the lungs. The ball pen and ruler to mark the location on the body and for measurement. And also a gown to cover the client and provide privacy. Perform hand washing, don gloves if deemed necessary to deter the spread of microorganisms and to prevent contamination. Greeted the client politely and client's companion if around. Introduce self and verify the client's identity. Ask how the client would like to be called during the assessment. Establish rapport with the client. So this is done to verify if you're meeting with the right client and at the same time establish rapport. So, good day. Okay, thank you. Good day, I'm your student nurse for today. My name is Isaiah Michael J. Velasquez. May I verify that this is Hazli Velasquez?
Yes.
Okay, tell me your age, please.
14.
Okay, so during our assessment, what name should I call you?
Hazli.
Okay, so Hazli, what is the reason for seeking care today?
Maglisod og hinga.
Okay, so explain the procedure to the client and how he or she can participate during the assessment. Provide the client the opportunity to clarify, ask, or raise any concern. This is to ensure that the client is aware and understand what we will be doing and assessing later on. So Hazli, today we will be conducting a thoracic assessment. Okay, so I will be assessing your front and back or your anterior and posterior. Okay. So, do you have any questions or clarifications before we start?
No.
Okay, so I would also like to add that later on I will be asking you to stand up, sit down, bend, and many more. Is that okay?
Yes.
I will also be marking your body using a ball pen and measure it using a ruler. Is that okay?
Yes.
Okay. Ensure client's comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secured, and free from distractions. Position client to be seated comfortably. In women, drape the anterior thorax when it is not being examined. So this is to ensure that the client is not uncomfortable. So firstly, let's close the curtains and doors. Okay, so Hazli, I want you to wear this gown, remove your shirt, okay? I will be facing this way. Tell me if you're done.
Mana.
Okay, thank you. So, surveying the chest and respiration. Check for signs of respiratory distress such as nasal flaring, pursed lip breathing, and retractions or problems with oxygenation. Observe the color of face, lips, chest, and fingernails. So this is to check symptoms related to difficulty of breathing. Okay, Hazli, please look at me. Okay. So may I ask, when did you start to notice that you have difficulty in breathing?
This week lang.
Okay, thank you. So that is very good that you seek care immediately. I noticed that you have a nasal flaring. We also have a slight pursed lip breathing. There are no retractions, which is good. Okay, please look at me. Okay, so you have a minor problem with oxygenation since you are experiencing difficulty in breathing. The good thing is that the color of your face, lips, chest, and fingernails are all good. It is pinkish. And since your color is moreno, the color is good. I don't see any discoloration. Examining the posterior thorax and lungs, inspect configuration while the client stands with arms at the side stood behind the client and observe the position of scapulae and the shape of configuration to the chest wall. To assess if there is any deformities or abnormalities. Okay, Hazli, I want you to stand up. Okay, I want you to face the curtains. Okay, so I will be raising the gown to inspect the scapulae and the shape of the chest wall. Is that okay?
Yes.
Okay, I'm going to touch the back of your body, okay? now sit down. Thank you. Inspect for spinal alignment and deformities. From a lateral position, observe the 3 normal curvatures, cervical, thoracic, and lumbar, to determine if the client has kyphosis or lordosis. So Hazli, I want you to stand again, face the curtains again, and I'm going to raise the gun, okay? Okay, I want you to stand up. Okay, stand still, very good. Okay, I'm going to check. Still, to assess for lateral deviation of spine or scoliosis, observe the standing client from the rear. Have the client bend forward at the waist and observe from behind to determine if the client has scoliosis. So, okay, Hazli, I want you to cross your arms just like this, okay, and okay, facing here, and I want you to bend forward just like this up until to where you can bend. Okay, so I'm going to raise it again. Okay, okay, very good. Okay, I'm going to check again. Okay, stand still. I'm going to check it from the rear. Okay. Okay, you may now stand up. Thank you so much. You may now sit down. Palpating the posterior thorax. Assess the temperature and integrity of all chest skin to check for skin perfusion. Okay, so please stand up. Let's just, here's your shirt. Let me just put it here to be clean. Okay. Okay, I want you to, okay, sit down. Okay, please raise the feet. Thank you. Okay, I'm going to raise it again, okay? So I'm going to check if there is any skin perfusion. Okay. Okay, are you cold, sir?
No.
Okay. Okay. Palpate all thorax areas for bulges, tenderness, or abnormal movements, especially for clients who have respiratory complaints to check for any further problems. So, let me raise it again. And now I'm going to check for tenderness and masses, okay? Okay, all looks good. Okay. Now let's move on. Palpating the posterior thorax for respiratory excursion, thoracic or thoracic expansion. Place the palm of both your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally to check for any irregularities, irregular expansion of the lungs. I'm sorry. Okay, so I'm going to raise it again. So I will be placing my hands just like this, okay? Just like this. Okay. Ask the client to take a deep breath while you observe the movement of your hands and any lag movements to check for any lag movements. Okay, so I want you to sit up straight. Thank you. Okay, so when I say so, breathe in and breathe out deeply, okay? Okay. Breathe in, breathe out, breathe in, breathe out. Again, breathe in, breathe out. Thank you so much. I'm going to cover you up. Palpating the thorax for vocal or tactical frenetus, the faintly perceptible vibration. So, place the palmar surfaces of your fingertips on the ulnar aspect of your hand or closed fist on the posterior thorax, starting near the apex of the lungs to check for abnormal vibrations. I'm going to raise it again. So I will be placing my fingertips here up until here, okay? Ask the client to repeat such words such as blue moon or 1, 2, 3 to check the vibrations in the lungs. So when you feel my fingertips touching your body, I want you to say blue moon, okay? Let's try it.
Blue moon.
Okay, very good. Repeat the 2 steps, moving your hands sequentially to the base of the lungs. Start toward the midline of the level of the left scapula, over the apex of the left lung, and move your hand left to right. Comparing movements bilaterally, move symmetrically and downward and or to cover the lateral portions of the lungs at the bases. So this is to check the different vibrations on each side. Okay, let's start the assessment. Say blue moon, please.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay, thank you. Again.
Blue moon. Blue moon. Blue moon. Blue moon.
Again.
Blue moon. Blue moon. Blue moon. Blue moon.
Compare the parameters of both lungs and between the apex and the base of each lung, using each or either one hand and moving it from one side of the client to the corresponding area on the other side of using two hands that are placed simultaneously on the corresponding areas of each side of the thorax. So this is done to see if there were any difference or abnormalities on each side. Okay, I'm going to place it again and I want you to say blue moon again, okay?
Blue moon. Blue moon.
Again.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay, thank you so much. Percussing the posterior thorax, ask the client to bend the head and fold the arms forward across the chest. So this separates the scapulae and exposes more lung tissue to percussion. So Hazli, I want you to stand up again. Okay, please stand here and face again the curtains. Okay, I want you to cross your arms again just like this and just bend your head. Okay. Okay. So percuss in the intercostal spaces at about 5 centimeters or 2 inches intervals in a symmetric sequence to help to hear the resonant sound of dullness that could indicate fluid buildup. Again, so I'm going to raise the gown. Okay, stand straight. Good, and bend your head. Okay, so I'm going to percuss now, okay? Compare each side of the lung with the other, so this to check each side of the lung to see any differences or irregularities. Percuss the lateral thorax every few inches starting at the axilla and working down to the atrium. Again, so this is to hear the resonant sound or dullness that could indicate fluid buildup or percussion sounds. Okay. You may now sit down. Thank you. Measuring the diaphragmic excursion. Use percussion to identify the level of diaphragm and measure diaphragmic excursion. Percuss downwards from the above the expected level of diaphragmic dullness until dullness is identified and heard. So this is to measure the contraction and retraction of the diaphragm when doing a full respiratory cycle. Okay, so let me lift up your shirt again. Okay, please stand straight. Okay, I want you to breathe in and breathe out, okay? Through your nose, okay, not your mouth. Okay? Start. Okay, so mark the level of full expiration after gaining the patient's permission for the marking to know where the diaphragm level of diaphragm and to measure the diaphragmic excursion. So, Hazli, I will be using the ball pen now to mark the location. Is that okay?
Yes.
Don't worry, this is removable. Okay. Had the patient inhale deeply and hold it in, then percuss downward to the level of dullness and full inspiration and mark it. So we need the client to breathe deeply to accurately and assess and measure. Okay, so now I want you to breathe in and hold it, okay, when I say so. Okay, start. Okay, exhale. Thank you. Okay, now let's move on to the right. Repeat this process on the other side. Measure the distance between the expiratory and inspiratory level of dullness. To measure the distance between the inspiratory and expiratory. Okay, so Okay, I want you to breathe in and breathe out again. Breathe out. Inhale. Exhale. Okay, again, I want you to hold it in, okay? Inhale. Okay. Exhale. Thank you so much for your cooperation. Now I'm going to measure it. Okay, thank you so much for your cooperation. Are you cold, sir?
No.
Okay. Auscultating for breath sounds. Place a diaphragm of the stethoscope firmly and directly on the posterior chest wall to the apex of the lung at C7 or cervical 7. So this is done because the diaphragm of the stethoscope for transmitting the high-pitched breath sounds. Okay, I'm going to raise it again. Please stand straight. Okay, so I'll be placing the diaphragm of the stethoscope here, okay? Up until here. Up until here. Okay. Ask the client to breathe deeply through the mouth for each area of auscultation. So each placement of the stethoscope. So this is to distinguish the normal sound from the abnormal one. So I want you to breathe in. Here. I want you to breathe in through your mouth just like this. Can you do it?
Yes.
Okay, go. Okay, thank you. So when I place the stethoscope, when you feel the stethoscope on your body, I want you to breathe in and breathe out, okay? Using the systematic ladder pattern used in percussion, listen to each point of the breath sound during a complete inspiration and expiration. So this technique allows you to compare one side of the chest with the other in a systematic manner and detect any asymmetry. Okay. Let's start. Again. Again. So compare findings at each point with the corresponding point of the opposite side of the thorax. Note the location of the chest wall where adventitious side and are heard, as well as the location of such sounds with the respiratory cycle. So this is to distinguish a normal sound from the abnormal one. Okay, let's do it again. Okay, thank you. Let's move on. Auscultate voice sounds follow some pattern as above. So the bronchophony, so we will be assessing 3. The bronchophony, ask the client to repeat the phrase 99 while auscultating the chest wall. So this is to check for muffled and indistinct sound. Okay. I'm going to raise it again. So again, when I place my stethoscope, I want you to say the 99, okay? Okay, let's try it.
99.
Again.
99.
Very good. Let's start the assessment.
99. 99. 99. 99. 99. 99. 99. 99. 99, 99, 99, 99.
Okay, thank you. Egophony, ask the client to repeat the letter E while listening over the chest wall. So we should be able to hear a long E sound. Okay, again, when I place my stethoscope, I want you to say E, okay? Let's try.
E.
Very good. Okay, let's start.
E. 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 E, 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 E.
Thank you. Whisper. Ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. So we should hear a faintly and indistinct sound. Okay, so in this part, I want you to whisper 1, 2, 3 when you hear, when I place the stethoscope. Okay? Try. And whisper it. Just like that. Very good. Okay, now I'm going to start. Okay, thank you so much. Assessing the anterior thorax. So inspected breathing patterns such as respiratory rate and rhythm, adequacy of respiration, and enables the identification of changes to respiratory function. So before we start, let me just cover lower extremities to provide comfort. Very comfortable?
Yes.
Okay. So please, I'm going to raise your down. Okay, now I want you to place your arms. Okay, very good. And just so. Okay, so I'm going to palpate. Okay. Inspected the costal angle formed by the intersection of the costal margins and the angle at which the ribs enter the spine to inspect if the costal angle is less than 90 degrees and if the ribs are intersected into the spine at 45 degrees. Okay, so again, I'm going to palpate to check. Okay, thank you. So next, palpating the anterior thorax for tenderness, sensation, and surface masses. So using your fingers to palpate for tenderness and sensation, start palpating with your hand positioned over the left clavicle, over the apex of the left lung, and move your hand left to right. Compare findings bilaterally to check the breathing movements of the thorax. Okay, please. Okay, so I'm going to check. Move your hand symmetrically downward toward the midline of the level of the breast and outward of the base. Include the lateral aspect of the lung to check for any deformities and shape of the thorax. So again, start palpating. Thank you. So repeat the sequence in palpating for the crepitus and the fremitus in the anterior thorax. So this is to check for any crackles in the chest wall. Let's start here. Okay, please. Okay, look straight, please. Look straight your head. Okay, very good. Let's repeat the process. Okay, thank you so much. So now, palpating the anterior thorax for respiratory excursion. So place the palm of both of your hands on the lower thorax with your fingers laterally along the lower rib cage and your thumbs along the costal margins to assess the movements of the thoracic diaphragm during breathing. Okay, so I'll be placing my hands just like this. Okay. So, ask the client to take a deep breath while you observe the movement of your hands, again, to assess the movement of the thoracic diaphragm during breathing. So, again. Okay, so I want you to take a deep breath. Inhale, exhale, inhale, exhale. Percussing the anterior thorax symmetrically. Begin percussing above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Compare the lung on one side to the lung on the other side. Displace female breast to facilitate percussion of the lungs to assess for lung resonance. So since we don't have a hospital bed, we need to lift the head. So we will be improvising by adding one more pillow. Please sit up. Are you comfortable?
Yes.
Okay. going to, okay, please don't move. Okay, thank you so much. So, auscultating for anterior breath sounds, adventitious breath sounds, and voice sounds. So, auscultated the trachea, so the bronchial and the tubular breath sounds should be heard. Let's start. Please don't move your head. Okay, I'm replacing the diaphragm here. Thank you. So, auscultate the anterior thorax. Place a diaphragm on the stethoscope firmly and directly on the anterior chest wall. Auscultated from the apices of the lungs slightly above the clavicles to assess both the lungs and the sixth rib. Follow the sequence for anterior chest auscultation. Ask the client to breathe deeply through the mouth in an effort to avoid transmission of sound that may occur with nasal breathing. Okay, so when you feel the diaphragm or the stethoscope, I want you to breathe okay through your mouth, just like earlier, like this. Okay, I'm going to start. You. Listen at each side for at least one complete respiratory cycle. Listen for normal breath sounds and adventitious breath sounds. Follow the systematic ladder pattern. Distinguish normal respiratory sound from abnormal ones, for example, crackles. Okay, again, I want you to breathe in and out for me through the mouth, okay? Much. You may now sit down. You may now sit down. Yes, yes, you. Okay. Okay. So, summarize the information obtained during the working phase and discuss findings to the client. Discuss to the client possible plans to resolve health concern in the present in order for the client to be informed on the assessment and finding. So, to summarize it all, you have a minor problem in breathing. So this means that you have a slightly problem in oxygenation. Other than that, I don't see any irregularities or abnormalities in your anterior and posterior thorax. The coloration on the face, chest, fingernails, and lips is good, and I don't see any discoloration. Assess for client's understanding of the plan and the need for further teaching. Provide the client the opportunity to clarify, ask, or raise any in order to the client to learn what to do in the future and to clarify any questions or misunderstandings. So, since you have difficulty in breathing, I highly advise you to do some breathing exercises such as inhale 1, 2, 3 and exhale 1, 2, 3. Okay? So, do you have any questions or clarifications?
No.
Okay, so thank the client and ended the interview politely. Done aftercare, perform hand washing to end respectfully and to establish rapport and to deter the spread of microorganisms and to prevent contamination. So thank you so much, Hazli, for coming in today. And before we end, perform hand washing to deter the spread of microorganisms. Document findings in the client record using printed or electronic forms or checklists supplemented by the narrative notes when appropriate to have legal documentation of the assessment that was conducted. Okay, just going to write this down for documentation. Again, thank you so much, Hazli. Have a good day.